working as an HOD of physiotherapy department at Flexify Me. Flexify Me is a chronic pain management platform caused due to musculoskeletal disorders in neck, shoulder pain, knee pain, back pain, uh, due to conditions like spondylitis, slip disc, ankylosing spondylitis, etc. So we provide solutions which is unique combination of camera, vision, AI-enabled technology used for analysis and diagnosis, and the treatment involves physiotherapy, yoga, and mental wellness. So we are serving customers in more than 25 countries, and presently we have tied up with more than 50 corporates for their uh, employee wellness. Now, starting with my topic today, understanding chronic pain, right? So my topic will revolve or have, can you all see my screen? Yeah. The content of my today's topic or today's talk will be what is pain, what is chronic pain, how is it different, how we can diagnose chronic pain and how we can manage it, a case study, and some quick prevention intervention methods, right? So, what is pain? We all have experienced pain at some point of time in our life, right? सबको ही pain होता है हम लोग को. कहीं ना कहीं कभी ना कभी pain तो हुआ ही है, right? But let's understand what is the medical definition for pain. So, pain is defined as an unpleasant sensory or emotional experience, which is either linked to a actual tissue damage or a potential tissue damage. When I say an actual tissue damage, जो हमें सामने दिखता है, जैसे हमारे स्किन पे अगर कुछ कट जाता है, कुछ छिल जाता है, तो दर्द होता है, right? That is called an actual tissue damage. What is a potential tissue damage? So suppose you are playing, you are running, and suddenly you started having knee pain. You can't see what is happening inside. अंदर नहीं पता चल रहा है कि क्या हो रहा है, but still आपको pain हो रहा है ना? So that is called, can be due to a meniscal injury, या हो सकता है ACL में कोई इंजरी हो गई हो. सो एनी हिडन इंजरी या अंदर कभी चोट लगी हो, ऐसा हुआ है ना, लोगों को फ्रोजन शोल्डर हो जाता है. एंड इफ यू आस्क द डॉक्टर दैट व्हाट इज द रीजन फॉर माय फ्रोजन शोल्डर, सो यू एक्चुअली डोंट हैव एनी रीजन इज अननोन, वी कॉल इट इडियोपैथिक, कि रीजन नहीं है फ्रोजन शोल्डर का. तो रीजन ये होता है कि कभी आज से 5 साल पहले, 10 साल पहले, 15 साल पहले आप गिर गए थे, आपको चोट लगा, एंड उसका आफ्टर 10 years उसका रिपोकशन ऐसा हुआ कि रेंजेस सडनली अटकना शुरू हो गया या मूवमेंट धीरे धीरे कम होना शुरू हो गया. दैट इज कॉल्ड एज फ्रोजन शोल्डर. सो दीज ऑल आर वेरियस टाइप्स ऑफ पेन, राइट? नाउ व्हेन वी अंडरस्टैंड ओके व्हाट इज अ क्रॉनिक पेन, so pain can be subdivided into 3 categories based on its duration: acute pain, subacute pain, and chronic pain, right? Acute pain is somewhere which is lasts between 2 to 3 weeks of time, that we call as acute pain. Subacute pain time duration is somewhere close to 2 to 2.5 months, right? Chronic pain is a pain which lasts more than 3 months. So कोई भी healing के लिए एक certain amount of duration of time रहता है body के पास. अगर that exceeds that time, so if it exceeds this healing time more than 3 months, we call it as a chronic pain. Now, according to the IASP definition, again, let's read the clinical definition for a chronic pain. So chronic pain is characterized as pain without any apparent biological value that persists beyond the tissue healing time, normal tissue healing time, right? Typically exceeding more than 3 months. And it significantly impacts your functioning and well-being. This is called as chronic pain. Now, chronic pain को भी हम ना सब categories में divide कर लेते हैं to understand what is the reason of your chronic pain, right? So, broad categories are malignant pain, non-malignant pain, and a chronic pain syndrome. So, what is a malignant pain? Malignant pain मतलब कोई भी जो दर्द है, that is because of your cancer, right? Underlying tissues में अगर cancerous tissues है, if there is underlying cancer in some joints, in some organs, so that pain is called a malignant pain. कैसे पता चलता है? Typical symptoms जो होते हैं malignant pain के, you will have a excruciating pain specifically in the night. That is a malignant, indicates more towards it is a cancerous kind of a pain. Second symptom is there is massive weight loss over a short duration of time. So that indicates more towards a malignant pain. Inflammatory pain का मतलब होता है, inflammation क्या होता है? कभी भी कहीं पे जब हमें चोट लगती है ना, तो there is a process of healing. तो जो चोट लगने का बाद का प्रोसेस है दैट इज कॉल्ड एन इन्फ्लेमेशन, जहाँ पे वहां पे अंडरलाइन टिश्यूज में स्वेलिंग हो जाएगा, रेडनेस आएगा, टेम्परेचर थोड़ा सा वार्म लगेगा। दैट इज एन इन्फ्लेमेटरी रिएक्शन ऑफ आवर बॉडी टू स्टार्ट द हीलिंग प्रोसेस। तो एनी पेन विच इज बिकॉज ऑफ इन्फ्लेमेशन कब होता है? any recent surgery, any recent arthritic pain, जब आर्थराइटिक इज अ डिजेनरेटिव कंडीशन, राइट, जहाँ पे जॉइंट्स के बीच में डिजेनरेशन शुरू हो जाता है, तो वहां पे जब अक्यूट स्वेलिंग होता है, सूजन आती है, रेडनेस आता है, वार्मथ आता है, दैट इज नोन एज इन्फ्लेमेटरी काइंड। ओके, नाउ द नेक्स्ट कैटेगरी इज मस्कुलोस्केलेटल पेन। Musculoskeletal pain is any pain which is due to muscles or skeletal system. Skeletal system is your joints. तो कोई भी दर्द जो मसल और जॉइंट की वजह से आ रहा है is comes under the category of musculoskeletal joint. For example, if you're running and suddenly आपके क्रैम्प आ जाता है, काफ में क्रैम्प आता है, हैम्स में, हैमस्ट्रिंग में क्रैम्प आ जाता है, so that is a strain of the muscle that comes under musculoskeletal pain. Okay. Now, any pain which is because आप खेल रहे हैं, सडनली आपका एंकल ट्विस्ट हो गया, लिगामेंट में इंजरी हो गई, दैट इज कॉल्ड अ स्ट्रेन, ankle strain, that is a ligament injury, that also comes under your musculoskeletal pain. Then comes neuropathic pain. Neuropathic pain is basically nerve pain. So any kind of when the nerve is involved, कैसे पता चलता है कि हमारा नर्व इन्वॉल्व है? हम जनरली सुनते हैं ना, शायटिका हो रहा है, मेरा पेन पूरे हाथ में दर्द जा रहा है, तो यूजुअली जो सिम्टम होता है ना वैसे ही होता है, लाइक आपके बैक में पेन शुरू होता है, बैक का पेन खींचा हुआ पूरा हील तक जा रहा है, पूरा नी तक जा रहा है, तो दैट इंडिकेट्स मोर ऑफ अ नर्व पेन। तो नर्व पेन कैसा होता है? बहुत शार्प शूटिंग पेन होता है, with tingling, can be with tingling, numbness, sometimes pin and needles का sensation होता है, and dysphagia. Dysphagia is कभी आपको sensation उस एरिया में बहुत ज्यादा लगेगा या कभी उस एरिया में sensation बहुत कम लगेगा। So this all indicates कि हाँ, आपका जो पेन है वो more towards nerve pain है, nerve related pain है, right? And the last part is a chronic pain syndrome. So whenever we talk about a chronic pain syndrome, आप लोगों ने generally भी सुना होगा, डॉक्टर डायग्नोस करते हैं इसको एज फाइब्रोमायल्जिया, राइट, मायोफेशियल पेन सिंड्रोम या डायबिटिक न्यूरोपैथी। तो व्हाट इज फाइब्रोमायल्जिया? फाइब्रोमायल्जिया इज अ जनरलाइज्ड पेन, लाइक आपका पेन ना कोई एक जगह पे रेस्ट्रिक्ट नहीं है, मे बी आपके नेक में पेन हो रहा है, आपके अपर बैक में पेन हो रहा है, लोअर बैक में पेन हो रहा है, या राइट शोल्डर में पेन हो रहा है। सो द पेन इज यूजुअली इन द मस्कुलर एरियाज एंड इज ऐसे डिस्ट्रीब्यूटेड। दिस इज नोन एज फाइब्रोमायल्जिया, एंड बेसिकली जब आप इसको डायग्नोस करने जाते हैं ना, तो आपका एक्सरे भी क्लियर निकलेगा, आपका ईएमजी भी क्लियर निकलेगा, एंड यू एक्चुअली डोंट कांट कंक्लूड टू अ सोल्यूशन की व्हाट इज द रीजन ऑफ योर पेन। दोस कम्स अंडर फाइब्रोमायल्जिया. Diabetic neuropathy is completely different condition. If you have seen elderly people at your home जिनको डायबिटीज होता है, एंड आपने देखा होगा उनके पैर सूज जाते हैं, दे कंप्लेन ऑफ बर्निंग सेंसेशन इन देयर फीट, so these kind of pain goes mainly towards your diabetic neuropathy. तो ये हमारा chronic pain का categories हो गया. Now, how the pain is transmitted और how the pain is perceived, कैसे और क्यों important है हमें? ऐसा भी तो हो सकता था, हो रहा है कहीं पे दर्द हो रहा है, जरूरत नहीं है कि we should always realize कि yes there is pain. Why is it important for us to realize that yes there is pain? So the most important factor why we realize pain ना is body's defense mechanism. तो अगर मुझे कहीं चोट लग रही है और मुझे उस एरिया को संभाल के रखना है, तो द सरफेस और जहां पे चोट लगी है वहां से सिग्नल्स जो हमारे ब्रेन तक जाते हैं इज टू प्रोटेक्ट दैट ऑर्गन, सो दैट टू प्रिवेंट फर्दर डैमेज is the reason why we perceive pain or why our brain appreciates pain. Okay. Now transmission के जैसे pain transmission है, generally भी transmission के बहुत सारे ways हो सकते हैं. So suppose I want to travel from Calcutta, from Pune to Calcutta. Now there can be various ways. I can take a bus and break my journey. I can take a flight. I can take a train. So similarly, pain के transmission के भी बहुत सारे ways होते हैं. There can be fast fibers, which C fibers, A delta fibers. तो उतने मेडिकल उसमें नहीं जा रही हूँ, बट बेसिक जो होता है 4 पॉइंटर्स रहते हैं जिससे पेन आपके सरफेस ऑफ द स्किन से लेके ब्रेन तक ट्रैवल करता है. वो कैसे होता है? 2 कैटेगरी में हम इसे डिवाइड करते हैं, पेरिफेरल ट्रांसमिशन एंड सेंट्रल ट्रांसमिशन. पेरिफेरल ट्रांसमिशन इज आपके हाथ या स्किन सरफेस से लेके या जहां चोट लगी है वहां से लेके आपके स्पाइनल कॉर्ड तक जो दर्द का सेंसेशन या फीडबैक जाता है, दैट इज पेरिफेरल ट्रांसमिशन. उसमें 2 प्रोसेसेस इन्वॉल्व होते हैं. जब मेरे स्किन सरफेस पे ना वी कॉल इट नोसिसेप्टर्स, ऐसे नर्व एंडिंग्स रहते हैं, 3 नर्व एंडिंग्स रहते हैं। तो जब सरफेस में कोई भी चेंज होता है, ठंडा गर्म या पिन प्रिक और प्रेशर चेंज, लाइक किसी ने पिंच किया, तो वो जो नर्व एंडिंग्स रहती है वो स्टिमुलेट हो जाती है थ्रू दोज नर्व एंडिंग्स एंड आर पेरिफेरल नर्वस सिस्टम, जो नर्व्स रहती हैं उसके थ्रू this pain sensation or this electrical signal transmits to my spinal cord. Okay, now comes the central transmission. So from the spinal cord, again through my dorsal horn, again a nervous system route, this pain is transmitted to my brain, where the pain is being appreciated. बॉडी को पता चलता है कि हाँ, यहाँ पे किसी ने गरम लगाया है, या किसी ने पिन प्रिक किया है, या कट गया है, या जो भी इंजरी आपको हुई है. दिस इज हाउ पेन इज perceived by the brain, and that's the importance how the pain should be realized. Now the fourth process is modulation process. What is modulation processes? पेन को आइदर हम इनहिबिट कर सकते हैं या तो फिर हम उसे एग्जैजरेट कर सकते हैं, राइट? सो दिस इज कॉल्ड एज मॉड्यूलेशन ऑफ द पेन. नाउ मॉड्यूलेशन ऑफ द पेन कैन हैपन at again 3 levels. A, at the base level, that is your skin or nociceptor level, at your spinal level, या फिर at your brain level. The pain pathway. You are trying to reduce your pain. You were playing, suddenly you twisted your ankle. What will you do? You will apply a cold pack. What is it doing? It is again blocking your pain pathway. So this is how I'm modulating my pain. Right? So this is at the surface level. The second level is at my spinal level. So for example, a female who is going to deliver a baby, the doctor inserts injections at the spinal level. Why? So that it causes pain transmission again, to block that pain transmission and to have a seamless delivery. So here the level he is injecting is at the spinal cord level. So again, this is the second level. That's how modulation of the pain happens. Now, why it is important, what is different in chronic pain, how chronic pain and acute pain are different when it comes to pain transmission or perception of the pain. So there is a most important aspect is central sensitization. What central sensitization is? So central sensitization occurs in our nervous system. So whenever there is a constant, higher intensity, high activity of signals which are constantly fed in our nervous system, and the brain perceives it, irrespective there is any external stimuli. It's not necessary that there is an injury. It's not necessary that there is some kind of pressure change, temperature change, but my body is constantly feeling that pain. My brain is constantly feeling that pain. That is called central sensitization. Why this happens? Central sensitization specifically happens in chronic pain cases. Why this happens? So for example, you adopted a dog. You brought a dog in your family. Now slowly what will happen, you will start adopting that dog as your own family member, right? Over a period of time, the dog becomes a part of your family. Similarly, if the pain persists for a very long time, my brain will slowly adopt that pain, thinking that it is a part of my body, it is a part of my organ and a part of the system. Okay. So now what starts happening? Even if there is no pain or even if there is no tissue damage, the brain has already adopted the pain, and it is in a mode that, okay, there is a pain even without an external stimuli. How it is different, or why I'm telling you this, is to understand central sensitization is very important when we come to the solution, when we come to management of chronic pain. Okay, I'll again bring that topic when I'll be talking about the management of the pain. So now let's see how the pain affects my day-to-day living. Okay, so the very first thing, none of us would like to get up in the morning with aches and pains in our body. None of us would like to keep complaining about I have pain in my shoulder or I have pain in my back. This would be the last thing which anyone, like, no one would like this. So how it is going to affect my life? So the very first thing it will affect is the quality of my life. How this is going to affect the quality of your life? If you get up along with the pain, the very first thing you will be doing is restricting your physical activity. What will you think is, if I protect my joint or protect that area, it will help subsiding my pain. or it will help controlling my pain. Now, to protect that area, you will stop movement. If this persists, you will stop, you even feel like, I don't want to go to work. Because if I sit for long, my back pain will increase. So again, going to affect your life. You will isolate yourself. You will stop playing your sports or doing your recreational activity, whatever your liking is. And gradually this will start affecting your daily living. Your responsibilities as a mother, you have to, get your child ready. As a father, you might have to go to a PTM meeting. But all these things will start affecting your life. Now, when the quality of life is affected, definitely this is going to have social consequences as well. How social consequences? So you can complain of pain once, twice, thrice, but beyond that, after a certain point of time, no one is actually interested in your pain, you know, because they also don't have a solution for your pain. So what will you start? You will stop discussing your pain. You will start isolating yourself from the environment. This will start affecting your personal life, your relationship with your spouse, your family members, your neighbors, causing social isolation. Now, when this starts having social isolation, this also will start affecting you psychologically now. Because if this persists for a very long time and you restrict yourself from doing what you actually like, you restrict yourself from your sports, you restrict from talking, we all love, some of us love talking, some of us love singing. You will restrict all of it. This will start pushing you more towards of a phase of increased responses like anxiety, anger, depression, disturbed sleep, that is called insomnia, etc. Now, while you are going through all of this circle, this will also start affecting your socioeconomic status. How? You will start spending more on your medical bills. You The company will allow only a certain amount of days, for your medical leaves, not for a prolonged period of time. When we specially talk about chronic pain, it's like more than 3 months. So definitely it is going to affect your work, your promotions, everything. So we have to be very mindful that how we should control our pain, when we should control our pain, so that our activity doesn't get hampered, my sleep doesn't get hampered. Take care of my nutrition. This will help me in my personal growth, will help me maintaining the cordial relationship with my surroundings. Emotionally, I will be stable. Spiritually, I'll be sound. And I'll have a definitely amicable family and social life. So pain does affect us at multiple levels. Right? Now, how we can diagnose this pain, how we can diagnose and how we can manage our chronic pain. So when it comes, why I'm telling you these points, that why you should diagnose your own pain to a certain extent, you can't diagnose it too completely, but at least you should know that, okay, where am I standing today? Because accordingly, you can take that decision whom to reach out for the solution. Okay. So chronic pain, the very first thing is how severe it is. Is your pain mild? Is your pain moderate? Is your pain at a very high level? Is at a very severe level? Because if it is mild and it has started, a gradual onset is there, but it is there. So indicates more of a musculoskeletal pain, more of a postural pain. If it is at a very serious level, very higher level, then there might be some underlying cause for that pain which needs to be diagnosed through investigations. Okay. What is the type of your pain? Again, is it a very sharp shooting pain? Indicates more towards nerve pain. Is it a very dull, diffused, spreaded pain all over your body, something like that? Then it can be, something related undergoing with your muscular areas, something related to pyrexia also. What is the location of your pain? Where is it located? Was it located at your neck and now it is spreading towards your shoulders and upper back? Was it located in your back and now it has started traveling down your legs? So the location, again, there is an involvement of the nerve, or is it a muscular pain, or what's undergoing that, right? Frequency, how frequently do you get that pain? Is it only in the morning? Indicates morning stiffness, morning pain, mainly goes towards degenerative process, osteoarthritis, arthritic cases. Is the pain more towards the end of the day? when you are sitting and working and then feeling tired? Indicates more towards the musculoskeletal pain again, postural pain again. Is it more while you are doing high intensity activity? Indicates there can be some injury inside the joints, and that's why the pain is triggering when we load it. Okay, so that's why understanding your pain is very important. Why we need to understand what are the aggravating factors, what increases your pain, so that you don't perform those activities which aggravates your pain. Give the area rest. What are the relieving factors? Follow those relieving factors. Sometimes your back pain might relieve when you lie on your stomach. So that gives the therapist or the physician an indication, okay, what kind of a pain it is. Okay. Again, social, emotional, and cultural and spiritual factors like stress. Does stress affect your pain? When you are stressed, when emotionally you are low, does that increase your pain? That means there is some psychological factor also playing alongside the physiological factor. So understanding your pain is very important. Now, pain cannot be measured. Pain is a subjective thing. Like you cannot actually measure or calculate ki, okay, Dr. Gargi is having this much amount of pain. No, you can't, because pain is very subjective. If for me, my pain is 8 on 10, for example, for someone else, it can be 7 on 10. For some other person, it can be 5 on 10. So everyone's perception of pain is different. That's why when we try to judge the intensity of your pain, we usually use numerical pain rating scale. It's a scale of, or visual analog scale, from 0 to 10, you mark your pain, wherever you feel your pain is. Now, how can you manage your chronic pain? Okay, so before management, I'm sure every one of you must be tired by now that there is too much talking going on, and I'm sure you must be working in front of your laptops throughout the day, and you are tired. So let's do a quick drill. If you are very tired, the very first thing you're feeling head is heavy or heaviness in your eyes, what you can do is to sit straight, tuck your chin in, close your eyes. Have you all done that? Close your eyes. And now look towards, move your eyeballs towards your right. Take it to the extreme right. Hold it for 5 seconds. 1, 2, 3, 4, and 5. Now take it to the extreme left and again hold it for 5 seconds. 1, 2, 3, 4, 5. Now take your eyeballs, don't move your head, just take your eyeballs up towards the roof as much as you can without moving your head. And again, hold it. 1, 2, 3, 4, and 5. Now look down again without bending your neck and hold it for 5 seconds again. 1, 2, 3, 4, and 5. Now you have to look towards the right side and up in a diagonal way. Okay? Take your eyeballs towards your right up side diagonally. Hold it. 1, 2, 3, 4, and 5. Take it down diagonally towards your left. Down diagonally towards your left. Hold again. 1, 2, 3, 4, and 5. Again. Now take it left up diagonally. Hold it. 1, 2, 3, 4, 5. Now take it right down diagonally. 1, 2, 3, 4, and 5. And bring it to the center. Rub your eyeballs clockwise and anti-clockwise. And relax. Open your eyes. Are you feeling fresh? Are you ready to bear with me for a few more minutes? Right. So let's see how you can manage a chronic pain. So chronic pain can be managed by various ways, right? You can take medicines, that is pharmacotherapy. You can go for modern cognitive behavioral therapy to understand, perceiving things more positively, going for counseling and many other more things. You can go with your physiotherapy. So physical therapists, they basically work with you to help you understand your own pain, take a control of your own pain by educating you more, by making you understand how you can cope with your pain, what is the what how you can solve your problems, for the pain. Pacing up your activities slowly and gradually. Sleep, how can you sleep better, and relaxation. So this was a quick technique of relaxation whenever you are working in front of your desktop and you suffer or feel heavy with your head, heavy with your eyes, and tired, overall tired, feeling very lethargic, low in energy. Please perform this. This will immediately give your eyes a bit of relaxation. You must also feel that sometimes my eyeball movements are less. You might not feel that the eyeball movement going diagonally up towards the right is a little restricted. So you might feel all these things. So keep doing this, right? So next is alternative treatments. How alternative treatment can help you. Alternative treatments may you can get Ayurveda treatment, you can get yoga therapy. There are many other alternative therapies, Reiki, and many other healing, pranic healing, many other therapies with which you can deal with chronic pain. But the most important part is lifestyle changes, right? When we talk about lifestyle changes, we have to include everything in one basket. You have to maintain your physical activity level. You have to work through exercises so that your physiological part is taken care of. You have to work with your nutrition level so that your diet level, your nutrition is in place. You have to work with your mental wellness as well so that you are at peace. Now, why lifestyle changes is so much important when we talk about chronic pain. If you remember, we spoke about central sensitization, where chronic pain is basically adopted by our brain as a part of the family, as a part of the body. Now, brain has to de-learn it. We have to slowly make our brain wean off from that chronic pain. How we do that is, A, we are definitely treating the pathophysiology or the real reason, the root cause of our pain. But at the same time, we have to counsel our brain also. This counseling is done by mental wellness part. When we do these kind of counseling sessions, when we do the mental wellness part, it can include many things. It can include pranayama, breathing exercises, meditation, many aspects. As well, taking care of the nutrition part, this helps us to break the pattern of this chronic pain. Right? Now, let's see, there is a case study I would like to share. So the female is working at a very high post in a MNC bank. She is 44-year-old. She has a sedentary lifestyle when it comes to job, but actually she's very active. She's into gym exercises. She's also into yoga. She found us online and came to us the very first day I saw her. She had a severe back pain, which was rated 10 on 10. She was in tears. Her pain was radiating from her lower back to her right heel, and she has a sharp shooting pain. All the movements were restricted. And when we first assessed her, if you can see, so here you can see a slight deviation of the waist angle. If you see this waist angle and if you see this waist angle, both these waist angles are different, right? She is slightly shifted towards her left side because the right was painful. After 2 weeks of therapy, now you can see both the waist angles. Both the waist angles are same. So there was a slight deviation in the waist angles. The very first day when I asked her to sit in a long sitting position, definitely she had severe pain. She could make her left leg straight, but she couldn't make her right knee straight. At the end of 2 weeks, she was sitting with her knee straight, but still you can see her ankle. The ankle was more towards the floor and not neutral. So she's still not completely recovered with the ankle part. We still are stuck somewhere here. The third picture, if you see here on your extreme left, is the general test for the straight leg test. We do it for the nerve, where you can see the range is basically 60 to 70 degrees. She could lift her leg only 60 to 70 degrees, which indicates that there is a nerve involved. In the extreme right picture, you can see she could lift her thigh, which is 90 degrees to her spine. So that means the spinal nerve area tension is relieved, but her knee is still bent. that still indicates, yes, there is some muscular tension which is still there. So we are working on it. So what we did is actually we worked on her spinal mobility. We worked on the muscular flexibility. The most important was working on the nerves. So we worked on the nerve flexibility as well to improve or to show these changes. She's still under treatment because it's been 2 weeks. It's a fresh case. That's why I wanted to share with you guys. So let's understand how prevalent neck pain, postural low back pain, mechanical neck pain is in corporate life nowadays. So lower back pain, so what is the prevalence rate? So you can see 80% of us, 80% people suffer from low back pain. 48% are Indians amongst these. Females suffers the most from low back pain. The prevalence rate is 8 to 15%. Females suffers a lot. 8 to 15% do have a reason why they have lower back pain. When I say they do have a reason, means there is some pathology going on, either it can be a disc, it can be a sciatica pain. So they do have some reason for the pain, but rest suffer from non-specific. Like you don't know what is the reason of the pain. Your X-rays are clear, your MRIs are clear, but still you are suffering from it. Now let's understand what causes that. So common reason for back pain, as you can see in the very first posture, is a sway back posture, right? So when you sway back, your muscles are not working properly. So your back is getting loaded. That's how you get the pain. Increased lumbar lordosis is very common with females, where the back muscles start getting tight, the front muscle starts getting weaker, again leading to back pain. The thoracic kyphosis, rounded shoulders, forward head, increased curvature of the upper back, leading to neck pain, upper back pain, and lower back pain as well. Forward-headed posture, commonly because of the use of laptop, desktop, mobile, leading to neck pain. And the last is a normal posture, how we should all carry ourselves, but difficult. Right? Now comes the next is the prevalence of neck pain. So 58.3 during past 1 year is reported people having neck pain. Past 6 weeks, people having neck pain, the ratio or the percentage is 87.8%. Common reason, texting. So smoking is the new texting. Texting is the new smoking, sorry. So if my neck is carrying my head weighs 1/7 of my body weight. So if I weigh 70 kgs, my head weight is 5 kgs. Now, as soon as I start bending my head, you can see in the picture, the more the load increases on the neck. Okay. So here goes 30 degrees from 5 kgs, you have already come to 20 kgs. 60 degrees, complete bending of the neck. From 20 kgs, you have already reached 30 kgs. So your head weighs 30 kgs on your neck. So in this case, definitely the discs are going to involve, definitely the muscles are going to involve, and there will be nerve involvement as well. So please, I'll show you a few exercises, measures also, how you can manage this. Shoulder pain, again, can be 26% people are suffering from shoulder pain, repetitive overhead movements, compression, arthritic condition. Major reason is weakness of the muscles and poor posture leads to shoulder pain. Right? So let's do some quick exercises, how we can do some table or desk exercises. I hope you can see my screen. Yeah, you can open up your arms. This you can do when you are in the office. Place your hands on your shoulders and join your elbows together and simultaneously rotate your elbow. This is a very simple shoulder circle. When you are doing it, please don't do it in a hurry. Feel that the back of your muscles are working. Then you are taking your elbows backwards so that your scapular muscles, that is your upper back muscles, they join together. Right? The next exercise, what you can do is in a sitting position, right? A neck stretch. How you do it is, you take your arms down, take one hand down, and take the other hand over your neck, pull it towards the side. Ensure that your shoulder should not hike, your shoulder is down, pull it, hold it for at least 10 to 15 seconds, feel the stretch and relax. Also, you can do it on the other side. So hold with the other hand. You can, suppose I'm stretching my right side, I'll hold my chair on the right side. I'll pull my neck to my left, slight overpressure, 30% of your maximum force, just 30%. You should feel a nice stretch on the side of your neck. Keep breathing while you are doing this exercise. And relax. Right? Let's come to the next slide. This one is very relaxing, thoracic extension stretch. This is for your neck as well as for your upper back exercise. What you need to do is clasp your hand like this, place it behind your head. Keep some space between the seat back, chair back, and your spine. Now, slowly extend your spine. Open your elbows as much as you can so that you feel a nice stretch in your front chest muscles, and then look upwards. Somewhat like this. This should be the posture. Right? Hold this position. Keep breathing. Keep relaxing. Close your eyes. Feel the stretch of your muscle and relax. Come back. Again, open your arms. Open your chest. Look up. Arch your spine. Hold. Keep breathing. Keep taking deep breaths. Where you should feel while doing this movement, you should feel at your upper back, upper and middle back region. Right? Come back and relax. Right? The next exercise is for your strengthening. Right? What we are strengthening, we are working on the scapular muscles, the upper back muscles. You all can sit on the chair, keep your hands on your waist as shown in the video. Slouch yourself, breathe in. While breathing in, move your scapular blades together. What are the scapular blades? If you can see this area, bring both your these two bones together. Make a slight V in between these two areas so that you feel that stretch, you feel the contraction of the muscle. Why this is important? Because most of the time we are sitting, we are working, so this area is mostly stressed. So this is for your upper back. Both these exercises are for your upper back, thoracic region. Keep doing. Keep breathing when you are doing these exercises. Never stop your breath. The breath should be normally taken. Right. The next exercise or movement is for the strengthening of your shoulder. How you do it is, you stand closer to the wall, bend your elbow, and push the wall slightly. How much pressure? Only 20 to 30% of your pressure. That's it. Not more than that. When you are pressing, do not move your arm forward or backward. Your shoulder should be in line with your neck and pushing the wall. Hold it for 5 seconds and relax. So this works on the strength of your shoulder. Okay. The next exercise is similar. Pushing the shoulder. Now you will stand with your back towards the wall. Bend your elbows and now push it backwards. Press the wall with your elbow, as shown in this picture. Again, how much pressure to be put is 20 to 30% of your maximum force. Right? Press it, hold it, count for 5 seconds, and then relax. Right. Now, coming to the general guidelines for pain management, the very first thing is please do not ignore your pain. Prevent or stop the pain before it reaches to the chronic stage. You have time. Please go for interventions, take therapy, reach out to doctors or a medical practitioner to understand what is the reason of your pain. Identify the cause of your pain so that you can treat the root cause. Just don't take medicines and mask your pain. Most of your pain, if you mask them, on the inside, it will keep growing. The pathology will keep growing, and ultimately it will become chronic. So please understand the reason for your pain and work towards a healthy and pain-free life. So the golden rule is health is first priority of your life, and it should be the first priority of your life. Thank you. Um, any questions you can ask? Open to video for back pain yoga exercise. For back pain, yes, but if you have pain and if you rate your pain more than 5, then I think you should take a consultation first to understand what are the do's, what are the don'ts, what is the reason for your pain. Then doing the exercises will make sense. Definitely you can have those exercises. My left leg has been getting numb after my disc bulge. Will I ever be able to do squats again? Definitely you can do squats again. So disc bulge, coming to disc bulge, it's a very interesting topic for me, not for the patient, definitely. So disc bulge usually happens when you are young, when you are in your 20s, when you are in your 30s. As soon as you cross the age of 32, 33, the disc stops bulging because now the disc will start solidifying. So whatever disc bulge you had in your young life, yes, how to control that? Later stages, the pain or the radiating pain is not because of the bulge. The bulge has already happened before. But yes, can you do squats again? Can the numbness will go? Yes, the numbness will go. You have to understand where is the disc bulge. So if I say ki, okay, if this is the disc, so is the disc bulge happening from the front, anterior part, posterior part, front part, or backwards? Or it's a lateral part, diagonal disc bulge. So if the disc, we have to understand the movement of your body, which is reducing your pain and numbness. Okay, understanding that movement is the initiation of your treatment. Then slowly we can go forward, prevent the disc from further bulging out. And the main thing, all our muscles are connected to the joints. So if I want to relieve my disc from pressure, I have to strengthen my muscles. I have to strengthen specific muscles so that the load on the disc reduces. Once the load on the disc reduces, and we are doing the correct movement, to some extent, the disc can come back. I'm not saying 100%, but to some extent it does. And definitely when you are strong enough, you are doing your regime and everything, you can reach to a stage where you can again do squats and higher intensity activities. I have multiple bulge in cervical C5. Okay, and taking physiotherapy, TENS, ultrasonic laser traction. Is it enough for treatment along with pregabalin? Okay, no, it is not enough because again, what I said, do not mask your pain. Taking medicines, taking physiotherapy, modality-based treatment is basically masking your pain. You should take the therapy. I'm not saying you should not take the modality treatment, take the medicine, but this should only be your aim to manage your acute pain. Once the acute pain is managed, please look forward where you will be strengthening your neck muscles, because as I said, majority of the disc issues, majority of our texting is the new smoking. So majority of our disc bulges, neck pain is because of this positional. So understanding the positional and treating the root cause, definitely it's going to help you and bring you out of it completely. I'm not able to sit after 1 to 2 minutes. Left hand gets numbness. Again, same, Ashu. It's the same thing what I just told you. If you are sitting and within a minute or two the hand starts getting numb, please get yourself assessed. Click your picture. Ask someone when you are working. Ask someone to click your picture when you are not conscious, and then see your neck, how your neck is placed. Ideally, when we sit or when we work, my ear should be just above my shoulder level. If there is an angle, there is an increased load on my neck, and that causes the numbness. Whenever there is numbness, as I said, in the chronic pain, it is related to your nerve. When doing the first exercise, elbow rotation, I feel a cracking in my bones. Is it normal? Should it decrease with time? Yes, cracking is something, which is usually because of stiffness. Cracking, if related to pain, then it is worrisome. Then you need to take care. Otherwise, cracking is normal. Cracking the joints is okay, but cracking the joint and feeling free, when at the initial stage you will feel nice and good, but you have to understand why you are feeling that, why you are feeling right. You are working in a certain position. Definitely there is change of your position of the muscles, change in the length of the muscle, change in the load which the muscle is putting on your joints. As I said, muscles are attached to the joint. So when the load reduces, when the muscle is putting load on the joint, your joint mobility gets restricted. When the joint mobility starts getting restricted, that's when you feel like cracking it. So at the initial time, cracking the joint will make you feel relieved, but this is not a long-term solution. And eventually, this your joint will not, be so flexible enough that even after cracking, you will feel, yes, I'm relieved now. So in short, please don't crack it. Do movements, exercises, corrective exercises so that you don't feel stuck.